Now, for the mechanism of neonatal sepsis, is it clear? For the mechanism of neonatal sepsis and the clinical presentation, generally the patient that have neonatal sepsis is going to present with what? Is going to present with fever. So that is the hallmark sign of an infectious process. Is it clear? Provided that you have an early onset neonatal sepsis. If you have an early onset neonatal sepsis, you just have a hallmark of fever. Is it clear? Other elements can tell you refusal to breast milk, to breastfeed. Is it clear? Refusal to breastfeed can also tell you have irritability. Irritability. Is it clear? Irritability. The child is more irritable, is crying when you just touch him. You can have that. Is it clear? So those are fever, refusal to breastfeed, and when the child is not active as before, telling you that there's asthenia, you can have those are elements that can tell you that there's an infectious process. Now, another element that can can tell you on the issue that is an infectious process, you can have neonatal jaundice, and we are going to have a lecture on neonatal jaundice later to visualize the different etiologies. But you need to know that the most common etiology of neonatal jaundice after physiologic jaundice is going to be neonatal sepsis. When it is a pathology, is it clear? The most common is going to be neonatal sepsis. So when you have jaundice in this patient, you can think of a hemolytic process which is occurring, and this jaundice is particularly a prehepatic jaundice. Is it clear? So those are the different elements, and it's also going to present generally with anemia. When you have anemia, you have jaundice. It just tells you that there is a hemolytic process, and that hemolytic process occurs because of the infections at the level of the bloodstream. Is it clear? So you are going to also have jaundice, is it clear? Which is just going to be as a result of a hemolytic process. Now, after jaundice, the next element that you can have now element much more associated with the central nervous system, which is much more with the central nervous system infections. Is it clear? When you have central nervous system infections, you have now to instead think of another etiology, which is meningitis. Is it clear? And those central nervous system symptoms are mostly going to be visualized now on the history and physical examination. The history, you can have elements like lethargy. Is it clear? Now, on the physical examination, when you want to assess for central nervous system, there are 5 elements that you have to assess. The first element is the level of consciousness. Is it clear? When you want to assess the level of consciousness, you use what is called the Blantyre score. Is it clear? Blantyre score, which is used less than 2 years of age. You use the Blantyre score to assess for the level of consciousness. It is divided into normal consciousness, it is divided into lethargy, that is 3 or 4, and it is divided into coma when you are less than or equal to 2. Now, after the level of consciousness, you have the tone of the child. If the child is hypertonic or hypotonic, usually associated with the meninges. It can also be tetanus. Is it clear? So those are the tone, or even kernicterus. The next thing after the tone of the child, you have the primitive reflexes. Is it clear? That you have to assess. You have to assess also the primitive reflexes in a child as the examination of the physical examination of the central nervous system. You assess also for the primitive reflexes. So the next central nervous system side that you have to evaluate also for audition. Is it clear? So how do you evaluate for audition? Generally, you just place your hand at the level of the ear of the child, and then you tap this sound. You evaluate this sound. Is it clear? And you find if the child is going to react. If the child reacts to that sound, it means that there is a favorable audition. And you need to know that audition of the child starts at the level of the 28 weeks of gestation. And then the fifth element is going to be vision. Is it clear? In vision now, you can assess if the child has, particularly if the child has a social smile. When you try to laugh, you try to when the social smile is already present in the developmental history. So you can try to smile with the child. You see if the child is smiling back. Is it clear? It means that there is no problem with vision. So those are the elements that you try to assess in the physical examination, particularly when you have central nervous system symptoms or nervous system symptoms. Is it clear? So when you have nervous system symptoms, you think of meningitis, you think of kernicterus. Is it clear? You think of kernicterus, and you think also of neonatal tetanus. Is it clear? So those are central nervous system symptoms by assessing the different elements of the central nervous system. Is it clear? So you, in this case, you don't think too much again of neonatal sepsis. So after evaluating all those elements of the physical, so those are the elements that you try to evaluate on the history taking. So you start with the central nervous. See the central nervous system signs, it means that just not just neonatal sepsis, but there are those other diseases. But now for neonatal sepsis, on the physical examination, never forget to measure the temperature of the child. Is it clear? With the temperature, you have a hyperthermia, it's going to be a hallmark sign for infection in children. Is it clear? Never forget to measure the temperature of the child. Now, the next element that you can have jaundice, and when you want to characterize jaundice on physical examination, you use the Kramer's rule. Is it clear? Which is divided into the Kramer's 1 to 5 that I'm going to explain more on neonatal jaundice. Now, so after measuring the temperature and jaundice, those are the two major elements that you have to evaluate on the physical examination of neonatal. You have to evaluate in neonatal jaundice. Now, the other element you have to ask yourself now, the question: if a patient has